Good morning, it's Dr. Anthony G back again, and I wanted to share another story with you. And here's the thing, just got done with my lovely and just talented and patient to work with me to get my hair cut, get my hair did. My hairstylist, Erica, she's the bomb. So if you're in Florida, around Orlando, and you want to be pretty, she's the lady to go to. All right, little shout out. Hey, the thing is this. So my stylist was talking to me about having a little tummy problem. One of the things that we have all too often in the medical field is a digestive complaint. So what I wanted to do is just kind of share with you as briefly as I possibly can the rundown of how this particular disharmony is treated. So you have a little rumbly in the tumbly, a little pain in the stomach, nausea every day. So what do? You go to the doctor, you say, hey doc, I'm nauseous, I'm not vomiting, but I feel queasy all the time, my stomach hurts when I eat, and that kind of fun stuff. Well, they're going to go into right away acute care model medicine, which is to give you a pill for every ill. So we have medications to give you for the nausea. If you're constipated, we can give you something that'll make you blow your bottom end out. If you have a headache, we can give you something for that. If you have stomach acid, we can give you something to suppress that. All these things, polypharmacy to give you all kinds of, pills, potions, and powders to go after that. The problem with that is that you're never going to be getting to the root cause. The questions have to be asked. In Balanced Protocol, the 2358 framework spells this out. Number 2 stands for the 2 questions you always have to ask whenever you have a disharmony, whether it be acute or chronic. You have to ask yourself, what do I need to add? What do I need to remove? The answer isn't just what medication do I need to add, and it's also not what type of herb or homeopathic or supplement that I need to add either. You also need to ask, well, what do I might have to take away? What am I consuming that could be doing that? Well, oftentimes in cases like this, it's one of the 5 causative factors of all disease known to man, which is the 5 in the 2358 framework. It could be a nutritional deficiency. If you have a deficiency in certain B vitamins like B6 in particular, you could, yield to nausea. That's why oftentimes pregnant women, you might be suggested that you take some vitamin B6 to thwart the nausea. So we know that. It could be stressors here over the holidays and partying and things like that, not just when it comes to psychological stress, but physiological stress when it comes to temperature changes, light cycle changes, changes in your sleep, different things like that. Number 3, it could be a microbial infection. In this particular case, it could be H. pylori. It could be another type of opportunistic bacteria. It could be a virus, things like that. So it could be microbes. The other thing is then you can go on to, it could be a toxin of some sort. If you're in an environment that is conducive to more chemicals, like in this particular case, being a hairdresser, you're around the chemicals of permanents and hair colors and hairsprays and gels. You're constantly bathing your hands and your nose and your air that they're breathing in with all kinds of toxins, and then of course all the microbes from all the people, hair salons, they're clean, but they tend to be like an airport, right? They're kind of petri dishes. Is that a word, petri dishes? But the thing is then it could come to allergies. It could be food that could be the problem. It could be gluten. It could be dairy. It could be, eggs. But the problem is when you go to most conventional care today, their testing is not necessarily going to be the correct testing. By the vast majority of them, when it comes to, like, say, the food allergy part, they're going we're going to test you for some allergies. Well, the problem is conventional medicine does not test allergies the way that a functional medicine practitioner would. Specifically, if you usually go, you'll get one of 2 particular type of tests, like the skin prick test, like a RAS test, or you'll get IgE testing. That doesn't tell you immunocomplexes. It doesn't tell you the other stages of reactivity that are delayed allergies. So the thing I wanted to share with you, the take home on this particular little snippet, is that it's so common for me to run into individuals, patients and friends and family that have an acute particular condition, something that's been bugging them now for a week or 2, and they've been trying to do things. In this particular case, she was like, well, I don't want to take any medications. Well, I just don't want to take any pills. Well, the problem is don't poo-poo the medications, okay? Pharmaceutical medications are very prudent. They're very powerful, very useful. If used correctly for a short period of time, you always want to go into them with an exit strategy. So listen, if you need a temporary medication, Don't automatically blanket it because, oh, it's drugs and I want to stay from drugs and we don't want to send any money to the pharmaceutical industry. I don't either. But at the same time, remember, they have a powerful therapeutic benefit potential, just like herbs do and just like food does. Now, is food the best medicine? Absolutely. All solutions must begin and end with what you're eating, what you're feeding your body, because that's how its whole premise is fueled, both on fuel, the information that food imparts, and then what it does cascade-wise to the immune system and how your mitochondria make energy and repair and things like that. So food is where we're going to center on this. But in the absence of personalized clinical data, my recommendation in a case like this is to, number one, seek some relief from your symptomology. Don't be scared of the pharmaceutical medications if you need them. But when and if you get relief from a medication, don't stop the search. That's the biggest take home. It's what I actually call the happy slappy syndrome. Patients go, oh, okay, well, I have stomach acid or reflux or something like that, or nausea. I took medication X and Y and the problem went away. So that must have been the fix. What? Well, if you have a digestive problem and you take Maalox or Tums or Pepto and they resolve the issue, it wasn't because you were deficient in Pepto, Maalox, and Tums, because I never take those things, right? So it's not like taking those things prevents it. No, they were a treatment. You need to ask yourself the questions. Well, why? Practice why medicine, not what medicine, right? What do I have, right? Then so many people come to us as docs and say, Doc, what can you give me for this? Well, what I'll give you is an education, a dose of motivation, and some inspiration to find out what is going on inside of you. Seek some relief for it, but then keep going, right? It's like getting a little loan from your parents. No one wants to get a loan from your parents if you need some money, because the interest rate is terrible, right? That interest rate being that of a guilt scale and the little nagging stuff like, what's wrong with you? I had to give you some money. So the thing is that you need to do it, though, to keep the lights on, to keep your car from being repoed. That's my example. So the thing is don't be afraid to get a little help from pharmaceutical medications if you need to. But once and if you get the relief, go back to asking, well, why? Desire to seek further. And in the absence of specifics, if you can't afford the proper testing and things like that through a functional medicine practitioner such as myself, you can start eliminating some of the known offensive agents and let your body reset. Basically calm the storm by removing the typical agents that we would see, like gluten, eggs, dairy, possibly nuts and seeds and things like that. We can get into that in another video. But the take home here is simply that once you get a little relief, don't stop seeking greater answers as to why these things manifested in you. Always ask the questions, what do I need to add? What do I need to remove? And focus on number 3 of the framework of Balance Protocol is the order in which you go after it. Always seek to first nourish the body. Secondly, balance out the symptoms and things that you have. And third, purify, cleanse the body, right? So you got to go in that particular order, being mindful of those 5 agents of disease, if you will, those things that actually are truly at the root cause, okay? Don't get caught up in the name it, blame it, tame it game with, okay, you have GERD or acid reflux or H. pylori. All those can only occur in a weakened total body system. So what you have to do is support all factors. Don't just stop at one. Hopefully this makes sense to you. I just wanted to share that with you as I'm driving home with my new hair did. Hopefully it looks okay. Take care, guys. Until next time, let's live life in balance.